Not Just a Period, Reclaim Your Cycle, Harness Your Hormones, and Take Control of Your Health, written and read by Dr. Hazel Wallace. For footnotes, figures, and further notes, please see the accompanying PDF, which will be available to download from your audiobook library. Poem in Praise of Menstruation by Lucille Clifton. If there is a river more beautiful than this, bright as the blood red edge of the moon, if there is a river more faithful than this, returning each month to the same delta, if there is a river braver than this, coming and coming in a surge of passion, of pain, if there is a river more ancient than this, daughter of Eve, mother of Cain and of Abel, if there is in the universe such a river, if there is somewhere water more powerful than this wild water, pray that it flows also through animals beautiful and faithful and ancient, and female and brave. Dedication. For anyone who has ever felt confused about or been made to feel ashamed of their menstrual cycle, this book is a step towards reclaiming that narrative and embracing your power. About me. Hello, I'm Dr. Hazel, former NHS medical doctor and women's health nutritionist. Many people know me from social media as the Food Medic, where since 2012, I have made it my mission to provide evidence-based nutrition and health information through my books, website, and social media. However, in more recent years, I've dedicated my focus to women's health, because as a woman and a health provider to many other women, I have realised that our health needs are underserved and overlooked. I wrote my last book, The Female Factor, Making Women's Health Count and What It Means for You, to raise awareness of this. I also wanted to change the accepted narrative that in medical circles, women are simply small men, and argue that they should instead be seen and understood in their own unique way. I had hoped that this book would be the solution, and while it helped many, it actually sparked an even bigger conversation and opened my eyes to the scale of the problem when it comes to menstrual health. Since its publication in 2022, many women continue to flood my DMs and inbox to share their collective experience of struggling with distressing menstrual cycle symptoms, and of feeling dismissed by healthcare professionals who have led them to believe it's just a normal experience of having a period. You may be surprised to hear about the number of women who use up their annual leave as menstrual leave because their cramps are so debilitating, or the number of women who no longer have a period and have been given no explanation as to why, but have been offered the pill instead. Or, more sinisterly, the many women who have struggled for years to get a diagnosis for the severe cyclical mood disorder PMDD, premenstrual dysphoric disorder, and were batted away with "it's just period-related mood swings." When getting support from qualified health professionals seems impossible, many women feel like they have no choice but to take their menstrual health into their own hands. As a result, they often turn to unqualified menstrual health coaches and self-proclaimed hormonal experts on platforms like TikTok, who make a living teaching us how to balance our hormones with their various green powders and crystals. However, because of the lack of research and trusted voices in this space, the sad reality is that menstrual health and cycle syncing is quickly becoming the latest trend in the wellness industry. And many brands are jumping on the bandwagon, hoping to profit from women who have no one else to turn to. The irony is not lost on me that as a content creator, I spend a lot of my time undoing the harm caused by social media. Often when women first come to me in my nutrition clinic, there will be a whole host of women's health supplements that they've been encouraged to buy through targeted advertisements or following restrictive diets because they came across a video claiming carbs cause PCOS, polycystic ovary syndrome, or that dairy worsens endometriosis. The good news is that with the right nutrition support, alongside usual medical care, we can improve symptoms, long-term health, and quality of life of the women living with these conditions. I've achieved it firsthand with my clients and with my own menstrual cycle, but I want that transformation to be possible for all women. Alongside my team, we've been conducting research through surveys and focus groups to understand the scale of the problem and to give women a platform to share their experiences of their menstrual cycles and the support, or lack thereof, they've received. You will find their stories and the stats from this research peppered throughout the book, and if you help to contribute, I am hugely grateful.
Sample complete. Ready to continue?